My name is Trynell Holland, and I'm a social worker in the province of Alberta who is registered with the Alberta College of Social Workers. I have both an undergraduate and master's degree in social work and have been working in the field for over 20 years in the public and private sectors. I have focused my career on working with children and adolescents with medical, genetic, neurodevelopmental disorders, and/or comorbid mental health disorders along with their families. This population is often misunderstood and experience isolation. I help children and families in many ways, including connection to the community, psychoeducation, formalized therapies with a focus on attachment and trauma to treat both child and parental mental health concerns, family therapy, care coordination, consultation to build capacity within their community, and support to navigate complex systems such as health, education, and FSCD. The goal of these approaches are always to improve child and family functioning and are focused on the family's personal goals. It is my experience that parents can often have a difficult time understanding their child's complex needs given their various diagnoses and how these labels all impact each other. I always begin by developing a shared understanding of diagnoses, behaviors, and needs. Often, this includes supporting parents with feelings around loss of a normal child and grief issues. This process also often normalizes the experience for the child. I like to work from the framework of what I call the systemic house. The foundation of the house is each parent's needs. I focus on each parent's individual mental health needs as well as their understanding of their child's presentation and needs. The other levels of the house include looking at the marital relationship, the co-parenting relationship, their relationship with their children, and of course the roof of the house being the child's symptoms and behaviors, what others usually see. Supporting change and intervention at any of these levels have an impact on the family as a whole. I have worked with families for over 20 years. It's been both an honor and a learning experience to support these families on their own personal journeys. I remember working with one family who had 2 children, one of them being an adolescent female who was experiencing social isolation, suicidal ideation, had a diagnosis of obsessive compulsive disorder, or OCD, and academic issues. I started after my assessment, of course, with providing psychoeducation around anxiety, OCD, and described the treatment for OCD called exposure response prevention therapy to the client and her mom. We developed fear ladders together and target behaviors, and parents began to understand and identify how OCD had involved them in the ritualized behaviors. As we worked toward change with the OCD behaviors, I also used accelerated resolution therapy to target anxiety and trauma with the child. Given these interventions and the hard work of the client and family, they experienced a decrease in family conflict, increased socialization with peers, increased independence of the child, and more positive family and individual functioning overall, at home and in the community. When working with families, there are multiple perspectives, needs, and understandings. We have to gain knowledge in these areas and work toward mutual goals, understandings, and processes. This is both a dance and a journey that I support each family I work with through. Everyone's experience is different, and I honor these differences and use existing strengths to support their personal therapeutic goals. Please feel free to contact me today to see how I may be able to support you, your child, or your family. I look forward to connecting with you.